Did you know that about 60% of patients in labor and delivery end up getting an epidural for their labor pain management? And I am here to tell you that it is really confusing and tricky because your OB, while they can give you some basic information about the epidural, they are not the one doing it. It is done by an anesthesiologist or a certified nurse anesthetist in the hospital. And when you ask for the epidural, you meet them, you're usually in so much pain that you're really not able to have a full informed consent with them in the hospital. So I'm excited that you guys are here to learn 10 reasons why you might not want to get an epidural. This post is not here to scare you. Even knowing these 10 things, I still ended up getting an epidural several times. But I think it's important information to have so that you're not caught off guard by some side effects or different things that can happen. So I'm glad that you guys are here learning from my 20 years in labor and delivery with thousands of epiduralized patients plus epidurals of my own. Okay, the first one is that epidurals do have risks and side effects. Now, I'm not going to go into the side effects because I actually have a whole video on the weird side effects that you may experience with an epidural. So I'm going to link that one down below. But I do want to talk about some of the risks that people don't really think about all that often. And the first one, which they will mention when they come in to give you informed consent about the epidural, is a severe headache. It's called a spinal headache. It happens when they go in just a little bit too far and they break that spinal barrier and fluid leaks out. It is a really bad headache. There are things that they can do to fix it. It is pretty rare, but I have seen it happen and there are things we can do to fix it, but it is still that annoying headache postpartum. So that's something to be aware of. That's mainly the big one. Other things like fever. There can be some nerve damage for when they put in the needle. That same thing can happen when they put in an IV or a needle in any area of your body. Again, very rare. Some people get an allergic reaction to the medications that we use, and in extremely rare cases, death. Remember, if our oven was to give us informed consent, it would definitely end in death. And you can bet your bottom dollar that if your car had to give you informed consent every time you turned it on, it would end with you could die during this drive. So it's an important thing to know, but also know that we're taking risks throughout our day. And I've actually never seen or heard of somebody dying from an epidural, but it does happen just like it could happen as you get in your car. One of the things that one of the OBs would say, you actually had more risk driving to the hospital than you did in the C-section. Now, I'm not sure if that data is really even true, but it is definitely true with an epidural. The next one is that epidurals may delay your labor. Now, the studies are sort of out on this one, but I will say that I've seen people who get an epidural and the contractions kind of go away, and I'm not exactly sure why. Sometimes we need to increase Pitocin to make the contractions reappear, or sometimes we just wait and then they reappear. Now, we do give you a lot of fluid, and so sometimes I think that dilutes the oxytocin that's in your bloodstream. And once those fluids are processed by your kidneys, labor resumes, but it can delay labor. Now, I'm also here to tell you that it actually can speed up labor, but that would maybe be a reason to get the epidural, which is not what we're talking about today. Now, like we just said, one of the reasons you might not want to get it is that we do give you a lot of fluids. And I've seen my breastfeeding education friends say that can lead to baby having kind of an artificially high weight at birth. You'll notice after you have an epidural that you feel kind of puffy because we load in extra fluids because your blood pressure might go down, yada, yada. But that can make the baby have an extra high weight. And it's also going to make you pee a ton after you have the baby. Now, something to note, again, they want to keep baby in a certain percentile of how much weight they've lost. But if baby has lost a little bit more than that, and you feel like breastfeeding's going well, it's something worth mentioning to your provider is that, which would be your pediatrician most likely at this point, is that I got a lot of fluids during labor. Do you think that is affecting this? Could we wait another day, before you start supplementing? If that's something that you would like to try to avoid. Editor Hillary here saying, I'm not sure that I explained that well enough. So the idea is that the baby will get all this extra fluid that's just water and they'll quickly pee that off, losing weight. And then, their placentile will go down from how much weight they've lost since birth. And so if it's just fluids that they're losing, that's different than actual like body fat and all those different kinds of things. So it's just something to mention with your pediatrician if your baby's weight dips down lower than they would live. Now, here's one that not a lot of people think about, but epidurals numb you. And a lot of people, after they get the epidural, they're like, I do not like how this feels numbing my body. So I think it's important to know that is the plan going in. Now, we don't want to numb you entirely. The hope is to numb you about 80% and that you can still move your legs a little bit. And the good thing to know is that you can control how much epidural goes in. So we put it on something that's similar to an IV pump where it puts the medication in that we can raise and lower. So if you are feeling too numb and you do not like it, talk with your nurse to talk with the anesthesiologist to see if you can lower the rate. And if you love pro tips like that, be sure and get a great birth class in that has pro tips like that gives you a little peek behind the curtain. I'm going to put the class that I recommend down below. The next one is that epidurals may make it a little bit harder to push because you're numb down there. Now, you can ask for them to lower it, but sometimes lowering it causes an increased amount of pain. So you always have to balance those two different things. 6-7 is what I'm doing here. But I find that it takes patients a little bit longer to sort of get their sea legs underneath them to kind of know what their body is doing when they have an epidural. But once they figure that out, I really think that epiduralized patients do just as well as people who didn't have an epidural. And again, if you're feeling too numb, ask them to lower that rate for you. As a note, sometimes your nurse can just lower it. Like it kind of depends hospital to hospital. Sometimes they have to call the anesthesiologist. Maybe sometimes they have to call your OB. I don't know, but that's something to be aware of. The next one is that epidurals require a sharp needle. Now, so many people don't want to look at the epidural needle, and it is scary to look at. I will agree. It looks like it's really long, and I'm here to tell you that we don't use that entire needle, thankfully, in your back, but it does require a needle, and that's a reason why a lot of people don't want to get the epidural. They're afraid of needles. Now, the good news on this one is you literally cannot see the epidural go in behind you versus like an IV where you could watch me like a hawk when I put in your IV, but unless you're like the exorcist and can see behind you, you literally cannot see anything from the epidural placement. And they also numb you before they put the needle into your back. So similar to how they numb you when you go in for the dentist's office, it just numbs the skin. And then after they numb you, which you will feel kind of a little bee sting from the numbing, you really just feel pressure on your back. You no longer feel the sharpness of the needle. And I'm here to tell you that if you have a huge phobia of needles during your pregnancy, it might be a great thing to get a little bit of therapy about because, you're going to have a lot of blood draws, you're going to have the IV. And I actually have a friend who talked with her therapist, got a lot of tools and of things that she does to make it work for her, which includes headphones. She puts on music, looking away, asking him to cover it after. There are things that you can do and tools and resources that you can use to make your fear of needles less. I actually had a huge fear of flying because I had an uncle die in a plane crash in college, and I went to therapy to give me the tools and resources to be a better flyer, and it totally worked. I'm a much better flyer now. So there are things out there that can help. Now, here's something you need to know is that epidurals do take a little bit of time to work. If you were to ask for IV pain medication, once I get it and I put it in your IV, it works pretty darn quick. Only a few times. I have a whole video about IV pain medication. If you want to watch it, I'll link it down below. But an epidural takes a little bit of time to bathe those nerves in the medications that they give and numb those areas of your body. Now, this is usually about 15 to 20, maybe 30 minutes, depending on how your body reacts to it. But I think it's important to know that you will not be like numb right away when they give it. It takes a little bit of time. Now, here's one that people don't talk about and then they get upset online, and it is that you are going to need a catheter if you get an epidural placed. Now, every hospital does this different. Some people put a catheter in that just goes in and then comes right back out. And some people put a catheter in and then put a little balloon that keeps it indwelling, so they only have to put it in one time. Honestly, the choice as to which you would like between those two should be up to you. The studies are really mixed between those two as to which causes more infection or trauma to the area or decreases birth issues. It's really up to you. I wish that I had offered people the in-out catheter more often because me personally, I would rather just get it in once because it's kind of embarrassing to have it put in versus I know a lot of people really like to protect that area of their body and they would rather be catheterized every couple hours so that, they don't have something in there. So those are two different options, but you will need something to help clear out your bladder. Every once in a while, we have a patient that they don't have the epidural long enough, so they really don't need it. Or some people, although very rare, can still use a bedpan with an epidural, but since it is numbing your body, it also numbs the signals that you send to your bladder to allow it to empty. So a lot of times that doesn't work. And if your bladder were to fill up, it's right here in front of this uterus and it can make it so that the baby can't progress down. And so we really want to make sure that the bladder is not getting in the way of your uterus. Plus, honestly, I loved getting a Foley finally after I had my epidural. Those were like the 3 hours that I had that I didn't have to pee during, and I was grateful for it. Even when I was pregnant, I would be jealous of my patients that I was putting the catheters in because I knew that I would be going home and peeing all night long. I could have used a catheter. Now, here's another one is that you can't move as well with an epidural. I see a lot of people online saying, oh, get on all fours when you have an epidural. That is really hard when you have an epidural. Like your nurse can help you get up, but you just don't have the strength in your hips to really keep you in that position. And it ends up actually being pretty painful. And people usually only last a couple contractions before they're asking to do something different. So you just need to know that it limits your movement. That doesn't mean that your nurse shouldn't be moving you and that you shouldn't be trying to help them as much as you can. Great thing for your partner to get involved in as well. They can help position you so that the nurse doesn't need to find another nurse to help her position you. So that's something to know. Again, if you feel like you can't move very much at all, ask your nurse to lower it. And while we're on the topic of partners, I think partners also feel a little bit out of control with this whole situation. So getting them some information about the epidural can be really, really helpful. I recommend a birth class that can be done with couples so that they're getting prepared as well. I'm going to put the one that I recommend down below. Now, here's one, and if you're here with a pregnancy nurse, you're probably giving birth in the hospital, but they can only be given in the hospital setting. So if you're having a home birth or a birth center birth, you will not be getting an epidural. And that is a reason why a lot of people do not get an epidural, because it's not offered. Sometimes I see birth centers saying, we have a very low epidural rate. And I'm like, well, of course you do, because you can't do them at a birth center. You have to be in the hospital in order to get an epidural. And finally, because we're in the United States and we're the absolute worst, epidurals are expensive. And that can be a reason that some people do not get an epidural or they aim to do something else. Now, I don't understand why insurance will pay for an epidural but won't pay for a doula. That is a story for another day, but epidurals can be pricey. And if you are doing an all cash birth, some people do not get an epidural. I would encourage you, if you are getting a cash birth, to call the hospital, see what number you can call to find out if you pay in cash in advance, how much the epidural is in that sort of a situation, because often a cash pay epidural is much cheaper than if you wait to get the bill after you get the epidural. And I've actually seen patients who give their credit card at the bedside to the anesthesiologist. I'm not saying you have to prepay the epidural before you have even had an ounce of labor, but if you can pay them at the bedside, you could save yourself thousands. Now, quick reminder, there are lots of different pain management options. I have a whole video that goes through the different pain management options. Epidurals are definitely not your only option, so I'm going to link that one up above. And again, this isn't here to scare you. I'm not here to scare you, because even knowing all of these different things, I still got epidurals. And I found them very effective, and I was very happy that I got them. So thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared. I mean that. Please don't get scared for your upcoming hospital birth and epidural.